Many of you will know Matt. He's a nephrologist in his clinical practice and a graduate of the program here, completed his PhD a few year ago through the Department of Community Health Sciences. And Matt's been working with a number of other individuals. Fiona's been involved in the committee as well, and others in moving this forward. So, Matt.
Okay, thank you, Brenda. And thanks, John, for the overview. And I'll start off by saying, actually, I don't want to give my vision today. Actually, I'd much rather hear other people's visions. And so actually what I wanted to use this time to do was to actually just share with you a few narratives and a few concepts and sub-concepts that I think come out of precision medicine, and hopefully use this just as a seed to plant the discussion that we'll then have from our panel members and the working groups after that. So that's really my goal just for the presentation today. So really I wanted to just spend a little bit of time maybe distilling a few concepts or sub-concepts that come out of this idea of precision medicine and precision public health. And then I thought really to get our ideas going, we just pull actually 4 narratives that are out there in the literature, out there on the internet, people speaking or writing about precision medicine and precision public health. And I think you'll see they all have a little bit of a different vision. So I just want to hit on some of those themes. I don't think they're all of them, but there are a few areas that can get us thinking. And then really end on maybe some opportunities and challenges that we can think about as a department. So that's my plan. So I pulled this definition of precision medicine just off the back actually of the breakout group themes document here. And it talks about many of the same things John just talked about in a number of different definitions that have been put out. So this aims to collect, connect, apply vast amounts of scientific research data and information about our health to understand why individuals respond differently to interventions and therapies, provide predictive knowledge, and make tailored or targeted decisions. So when I look at this, I think there's a number of concepts and sub-concepts that just come out of this one definition. So there's certainly something about measuring and connecting data and information in the beginning. There's something about differences across groups, precision medicine being very focused on the patient level, but today I think we can think about different levels, populations as well. But it acknowledges differences or variability. There's something about prediction, and there's something about tailoring or targeting or recognizing that perhaps there's differences in what might be done or what might be done through a decision in response to this information. So just a few concepts to think about, I think, for the rest of the sessions. We all know that there are many pillars of research, and this could apply to education as well, but CIHR defines the pillars of biomedical research, clinical research, health services research, and then the cultural, social, environmental, and population health research. And I think most of what we talk about and is being described in precision medicine is very much focusing on themes 1 and 2. But really what I wanted to do is present more of the ideas that I think apply to health and how we deliver health care, and then the larger health of our population. So these themes 3 and 4 that I think are really less well defined, and there's an opportunity here to identify where we see precision public health fitting. So these are 4 people who have, I think, 4 slightly different articulations or narratives on what precision medicine or precision public health is. So I'm just going to spend a little bit of time pulling out some of the things they've written or said, just to hit on some of these themes. So the first person is Dr. Khoury, who actually wrote one of the papers that was distributed ahead of time and has written a lot about precision public health and specifically uses that terminology very frequently. So he actually is at the Center of Disease Control in the United States, and he's actually the director of their Office of Health Genomics. So when he talks about precision public health, he talks a lot about determinants, and certainly those determinants are very much including genomics and genetics and the ability to measure them. But he also speaks about recognizing their interactions with other determinants. So there is a recognition of the environment and the interactions between genes and the environment. And a big part of how he describes precision medicine and precision public health is actually trying to do research that identifies cohorts that are representative of the population. So he does talk about identifying disadvantaged populations, representative populations in the United States anyways. He recognizes that people will respond to treatments differently and they'll have different risks of outcomes. So he actually talks about the many determinants then that might help move from our standard approach where people may have very different determinants at a genetic, individual, environmental level, but there's actually abilities to characterize people in a more precise way within the population to identify their risks and how they might improve their health outcomes. This is Dr. John Spurtis. He's a cardiologist and a health services researcher in Kansas in the United States, and he's the director of health outcomes research. And his description of precision medicine is actually very much focused around how to optimize appropriateness and efficiency in the healthcare system. And he's thought a lot about how to do that with precision medicine themes. So this is a slide, a version of the slide that he sent, and he actually thinks about people who access healthcare or are out in the healthcare system. And actually we tend to see them as a number of groups of individuals. But actually even without new biomarkers or genomics, we already have tools and abilities to risk stratify or predict people who actually have very different risks of health outcomes. Some people actually are at very low risk, and some people are at very high risk of having poor health outcomes, and that there's actually is an ability to predict this. His focus is on integrating and applying these prediction tools within the healthcare system and providing information in healthcare at the time and place of decision making, really integrated within workflow, using precision medicine to make decisions in healthcare every day that are going to mean the right patient gets the right treatment at the right time. And by doing that, we can be more efficient and cost effective in care. So that's really a big theme of John Spurtis. And this is another slide of him which really talks about moving data through models that can be very complicated, but actually into very usable tools that are embedded in the healthcare environment for use. So another narrative around precision medicine. The third one I'm going to talk about is actually Dr. Victor Montori, who actually works at that should be the Mayo Clinic and is in the Knowledge and Evaluation Unit. And when he talks about these ideas, he actually doesn't use the term precision medicine, he talks about personalized medicine. But he's very interested in the decision-making process and actually sees personalization as actually understanding that patients actually have different preferences and values, and that's important in the decision-making processes as well. So it might not be about identifying their risk or trying to predict their outcomes, but understanding what treatments or decisions align with their values and preferences. And this is really where his work really lies, around these concepts of how do we make decisions together with patients that respect their values. And this is important in health and in clinical care, because it's not only important to look at the quality of the evidence, but that strength of that recommendation for every patient. And this is just an interesting graphic, just getting back to the language issue here, that it's actually plotting searches in Google for personalized medicine versus precision medicine over time. So we're using different terms, but maybe some of these ideas are not all new. And actually this idea of personalization being a form of precision has been there for quite some time. It's the red line, and it dates back for many years now. And it's really only in the last few years that we're seeing the terminology of precision medicine spike up and replace what we might have been calling personalized medicine for quite a while. This is really narrative number 4, I think, but this is Dr. Sue Desmond-Hellmann, who's the CEO of the Bill and Melinda Gates Foundation in the United States. So her work really focuses on global health and disadvantaged populations. So she's also spoken about precision medicine and precision public health, and she has a TED Talk that you can see on the internet if you're interested. She acknowledges that these concepts might not just apply to individuals, where we may focus on clinical interventions and treating patients for one at a time for health problems, but actually some of these concepts could be applied down to interventions that are done at population level or larger social levels in our in our society and target the context and the environments of where we live and the socioeconomic factors and other determinants of health. So really it comes back to very similar ideas that there may be populations of people at risk who can be targeted for interventions, that there may not be a one-size-fits-all approach to public health or population health interventions, just like there may not be a one-size-fits-all intervention for an individual patient. So really it speaks, I think, about determinants being thought more broadly than at an individual level where we've talked, maybe about genomics and biomarkers, but we start to look at higher level determinants of the socioeconomic, cultural, and environmental determinants of different outcomes. So I'm going to stop there and just reflect on a few comments that struck me from going through these different narratives that I've read so far. One is that what underlying all of these ideas is actually really, I think, some attempts to organize scientific inquiry in a cogent way, and I think we heard that already this morning around a strategy for how the coming School of Medicine is thinking about doing that. I think there's some merit to this idea that acknowledges that one size may not fit all, be it for an individual or for the population. I think as a bigger concept, it could be applied more broadly to health services research and population and public health. And I think it's not necessarily an either or. Maybe we don't need to think about this being different than public health. It's just a way that public health interventions and population health and health services research can be done as well. And then I think, the last one here is just to think about opportunities and opportunities for all of our community. I mean, I see a lot of themes in big data, figuring out the best way to actually use data and make it meaningful information. How do we get information to the people who make decisions, and really doing something meaningful at the moment when it's needed. And I think these are all the unifying features that could be applied. And I'm going to stop there, and I think just hopefully this is kind of an area that we can expand upon and hear some more ideas.